Hi, just waiting for one of the other platforms to come up. I hope you're well, and I hope that I can say something today that will be helpful. I'm very old and I'm not good at technology, so I don't know how to talk to you directly, but I'm very interested in what you think and feel and want to know. So please send me through the platform that you're watching on your comments, questions and criticisms, anything that you want to know or anything you think that could make my live streaming more helpful. I was a registered medical practitioner, a doctor in Perth, Western Australia for 53 years. And that's a long time. And I'm a bit of a workaholic, so I did a lot of work, and I had 500,000 consultations, home and hospital visits in that time, and saw a lot of stuff. Of course, mostly bad stuff. People don't go to the doctor when they're well and happy. They go when they're sick and sad. So I was very interested to know what were the most important things for a person to have a good life. What gave people a good life and what made their life nasty. And there are 7 things that I think are very important for having a good life. The first one is to be mentally healthy. It's so wonderful to be mentally healthy, and such a problem if you have mental health problems, which is why I do this work, to help people with mental health problems. Secondly, enough good relationships. Human beings need other people. Loneliness is now proved to be as dangerous as 15 cigarettes a day. So good relationships. Thirdly, high endorphins. Endorphins are chemicals we produce in our brain that relieve pain and distress and help to make us feel good. Endorphins is short for endogenous morphines. Yes, we produce morphine type chemicals in our brain, and they're very important for feeling good, but they're also very important because they manage our immune system. Our immune system is white cells, antibodies and chemicals in every part of our body that fight infections, allergies, inflammation, autoimmune diseases and cancers. You want to have a strong immune system. And the 5th thing is a habit of smiling. It's very important to develop a habit of smiling a lot. And why is that? Well, it's because we've got about 25 chemicals in our brain that make us feel happy. There's the over 20 endorphins I've just mentioned, and then there's dopamine, serotonin, oxytocin and noradrenaline, and they make us feel happy, make us feel good. But what we didn't know till more recently is that when we smile or laugh, our brain produces even more of those chemicals so that we get even happier. And when we smile, often the people we're with smile, and then the whole thing is better. Now, my 6th thing to have a good life was no addictions. Addictions are a disaster. I was interested to see in my medical practice who suffered the most and got the worst treatment, and the people who suffered the most and got the worst treatment were addicts. and they had many nasty problems. But I've now got a seventh thing that you need to have a good life, and that is that you need to know all the good and bad things that happened to you in your life in the three previous generations. That is your parents, your grandparents, and your great-grandparents. Now, you may not know a lot about your great-grandparents, but if anything big or nasty happened to them, you need to know about it, because there are a number of blind spots in mental health, which is why mental health is not as effective as we need it to be. And one of those blind spots is that doctors tend to treat people as individuals, as if they're on their own. It's just one person involved, and it never is. Mental health problems are always family problems. If your family had no mental health problems, then you'll have no mental health problems, or almost certainly have no. So we mustn't treat people as individuals. You mustn't think of yourself as an individual. You are part of two life streams, your mother's family life stream and your father's family life stream. And there's nothing more important in the whole of your life than the mothering you had. And your father is usually very important too, mainly indirectly, mainly because he supports your mother. And your mother's mother is usually very important. Mum's mum, grandma, is usually very important. I know all about that. So they are the seven things that you need to have a good life. Good mental health, enough good relationships, high endorphins chemistry in your brain, a strong immune system, a habit of smiling, no addictions, and to know all the highs and lows of the last three generations of your family, in case any of them has affected you. I've just texted someone who responded to this live streaming by saying that he has had lots of panic attacks and anxiety, and he's really sick of it and he can't find why. And I said to him, if you can't find why in your life, if there's nothing in your earlier life that caused you to become very anxious, it may be coming from someone else in your life, because often if a parent or a grandparent or a great-grandparent had things that caused them to be very anxious or to be very frightened, that can be passed down. When your grandmother was 5 months pregnant with your mother, your genes and chemistry were already starting to be formed. So that's how closely we were involved in our family. I was very distressed to see how much many people suffered with bad mental health and with relationship difficulties, and they consulted doctors and psychologists and marriage counselors and so on, and often didn't get that much help, weren't that much better. And one of the reasons for that, I found, was that there were so many blind spots. Now, I've just mentioned one blind spot is people thought people were individuals when they're really part of a family stream, and their mental health and how they relate to other people is closely affected by what happens in their family. And another major blind spot was that so often healthcare professionals don't look for causes, and you must find causes if possible. If you don't know what caused someone to have a mental health problem or to have recurring relationship problems, it's much harder to help them to get better, and they might get better, but they'll pretty soon relapse if the reasons are still there. So you need to know the causes. And often the causes were a long time ago. Often the causes were in your early childhood or much earlier life, and the people concerned no longer here. They're gone somewhere else, or they're dead and buried. But you still need to understand the causes, because even if you can't correct the causes of the things that happened that caused you trouble, you can correct how you respond to them. You can correct your chemistry flows and electricity flows through therapy and treatment, and that's very important to do. And that brings up another blind point. It's so important to solve problems, to fix problems early, and we have this blindness that people don't seek help until they're very distressed, and the healthcare profession don't reach people until they're very distressed. If you find a problem when it first starts, it's usually much simpler. The cause is usually obvious, and you can do things to help the causes, to fix the causes, and you can correct the problem comparatively easily. But what happens is, because there's a stigma with mental health, people don't like to admit they've got mental health, because everyone looks down on people with mental health and says it's their fault, even though 90% of the time it's not their fault. 90% of the time it happened in their childhood at a time when they didn't control what was going on, or it happened as a result of some accident or something out of the blue that traumatized them. But nevertheless, people don't feel good about having mental health problems, so they don't ask for help until it gets very bad. And when it gets very bad, it's been there for years and years and years, it's much harder to fix. So and the healthcare profession need to realize that the sooner they get onto problems, the faster they get fixed and the shorter the waiting lists get. But if the slower you are solving problems, the more work that person needs when they finally get to you, and that makes the waiting list longer, and then all the people on the waiting list are getting worse and worse. So we need to we need to realize that the time to fix mental health problems and relationship problems is early as possible. So, and that's some blind spots. Treating people as individuals when they're not individuals. They're part of a family or of two families. Not looking for causes. Nothing happens without a cause, and it's very important to find the cause. Even if you can't change what happened, if you understand it, you can work with it and you can get better. And thirdly, the third blind point is the need to get onto things as early as possible. So why were there waiting lists? And there were lots of waiting lists. That was because the tools that mental health care professionals use were weak and inadequate. Today we have tools for everything. Tools help us to do things faster, better, cheaper, more thoroughly. Where would we be without tools? When I was a boy, there were only two tools in the kitchen. One was a big tin dish that you poured water into from a kettle off the stove and washed your dishes and your knives and your forks and your spoons. And the other tool was a wood stove that every morning when you got up you had to light, and you had to keep on putting wood on it all day. And that was so much work and so slow. And now the kitchen's full of tools. We've got electricity and gas. We've got electricity and gas ovens and stoves that you can just switch on and switch off anytime, anywhere, with no problem, without much trouble. We've got refrigerators. Wow, how great refrigerators are. We've got dishwashers. We've got grinders and cutters and mixers. And everywhere there's tools. But in mental health there's only two tools, and they've both got big problems. The first tool is medicine. Medicine has got two big problems. Firstly, so many medicines are addictive. The people who would benefit from taking medicines need medicine that's not addictive, that works quickly, and it makes them better, and then they can stop taking it. But the people who make medicines want them to take as much medicine as possible for as long as possible. So they make a lot of medicines, as many as they can get away with, addictive. For instance, the commonest mental health problem is anxiety, worry type problems. General anxiety, social anxiety, panic attacks, obsessive compulsive disorder, phobias. And all the medicines for those anxiety, worry problems are addictive. Originally it was the barbiturates, many barbiturates, all addictive. And then they brought out these new, better ones, benzodiazepine, yes, Valium, Seropax, Mogadon, Xanax. And I saw people taking 20, 30, 50 Valium tablets a day, and they didn't work. The more they took, the less they worked. In fact, I had 10 or 11 patients over the years who were taking 100 Valium tablets a day. Oh, so what about Ambien and Stilnox? Well, they're very addictive. Ambien and Stilnox. I still remember a 65-year-old gentleman I had who was referred to me because he was taking 17 Stilnox tablets a day. And it wasn't helping him. The way that addictive medicines and all addictive substances work is that at first they give you great relief from some distress, but your chemistry develops some tolerance or resistance. So then you need a bigger amount of that substance to give you the relief. And when you take a bigger amount to overcome to give you the relief and overcome the resistance, you get even more resistance, and so it goes on and on and on. More and more of the addictive medicine or street drug, more and more resistance, until you end up you're on a heap of it and it's not working for you, and you can't stop because it's this addictive chemical has screwed up your natural chemistry so much to adapt to having all this unnatural chemistry that your chemistry, natural chemistry, goes into chaos if you suddenly stop the addictive substance. So you're taking buckets of addictive substance. It's not solving your problem because you've got such a high resistance. You can't stop it because if you do, you suffer terrible withdrawals. So medicines, addictive. The other problem is they're too damn slow. When you swallow a tablet or a capsule, it takes half an hour to an hour to go right down your gut and start to be absorbed into your bloodstream and back up to your brain. Half an hour to an hour, and just to start, and 1 to 2 hours to work strongly, and that's too slow. With mental health things and with addiction cravings, you want medicine that works quickly, very quickly. The other tool with mental health, which also has two big weaknesses, is talk therapy. That's counseling, psychotherapy, CBT, whatever you like to call it, group therapy, talk therapy. And talk therapy's got two problems. One is it's very slow. When you first see a person who's got an addiction, and you find that they've got 2 or 3 mental health problems as well, because addiction is really stage 4 mental health. Addiction is really stage 4 mental health. Then you need an hour to go into the history, to find where and how it started, what caused it, what's making it worse, and to work out how to help the person to get better. And with talk therapy, you need to see them at least once a week for at least half an hour to an hour, and that can go on for weeks and weeks and months and months. So talk therapy is very slow. And secondly, it's very costly. To be a therapist, you've at least got to have a 4-year Bachelor of Psychology degree. And a lot of people have a PhD, 6 or 7 year PhD. And the psychiatrists all have to have a 6-year general medical degree, and then a couple of years, at least a couple of years of general medical practice, and then 3, 4 or 5 years of postgraduate psychiatric training. So so therapists all are very intelligent people who've done a long, costly course, and they need to be paid well. They deserve to be paid well. If we don't pay them well, we'll have even less of them, because there's a great shortfall, a great lack of enough mental health workers for all the mental health work that be done. So how do we fix those problems? Well, over 27 years I developed 7 tools, a comprehensive package of tools which enable much faster, better management of these problems. The tools are videos. You have to spend a lot of time explaining things to people. It's very difficult for them to manage their problems if they don't know what their problems are, but it's not enough just to know what their problems are, to know that they've got ADD or they've got bipolar or they've got panic attack. They have to understand it. They have to understand, and so you spend so much time explaining things over and over again, and that to so many people. But the fastest, easiest, best, lowest cost way to understand a mental health problem is to watch a good video on that mental health problem. So videos. I started off with 7 to 12 minute videos, but people stopped watching long videos and they only watched 1 minute videos. So I had to switch to making 1 minute videos, and so there had to be a lot of 1 minute videos, because each 1 minute video just covers one thing. So I've got about 100 1 minute videos. The next thing was websites. You want to know something about something, you look the website. So I had a website that people could go to before they came to see me or after they came to see me, and could learn quite a lot from that website. and my website was mentalhealthvideos.com. But that was detailed and lengthy, and some people, that's what they want, and they'll plough through them. But a lot of people wanted something much shorter. So now we've also got smilefixit.com, which is just one page, which has got a line or two or three lines about everything, and you can just tap on the part that interests you and get more detail. And the next thing was an app. When I got very busy, and I got very busy because I was doing dual diagnosis, what I discovered was that 95% of addicts were addicts because they had very distressing mental health disorders which they didn't get proper diagnosis and treatment for, so they got street treatment, and the street treatment was always addictive. So 19 out of 20 addicts had mental health problems, and usually 2 or 3, not just one. So I needed to spend a lot of time diagnosing these mental health problems and doing what's called dual diagnosis, which is what they all needed and nobody was getting, which is the diagnosis and treatment of their mental health disorder at the same time as the treatment of their addiction. In the 1970s in Perth, sadly, they separated mental health care and addiction care, and that was a bad mistake. And so there were mental health clinics and there were addiction clinics, and the mental health clinics treated people's mental health problems, and they refused to see addicts. And the addiction clinics treated the addiction, but they did nothing about mental health. I sat in on these addiction clinics and I watched how people with obvious, very troublesome mental health problems had nothing done about it. So I did dual diagnosis, and back then I couldn't find anyone else was doing dual diagnosis, but now I'm very happy to say if you go online you'll find lots of clinics and doctors doing dual diagnosis, that is diagnosing and treating the mental health issues at the same time as treating addiction, and that works so much better. Almost no addicts were getting better with the just addiction treatment and no mental health care. They were put on addictive medicines. That was the only way they seemed to be able to be controlled, was to have an addictive medicine, and addictive medicine was better than a street addictive drug, but not that much better. And so the clinics were clogged up with people coming back for repeats of their addictive medicines, because they couldn't get too much medicine at once, because addictive medicines were dangerous. People could OD on them. So so when I started to do dual diagnosis, lots of people, the word spread, and lots of people came out of the woodwork and wanted to have their mental health treated, which they couldn't get treated either in the mental health clinics because they wouldn't see them because they're addicts, and couldn't get treated in the addiction clinics. The addiction clinics didn't treat mental health, and I got swamped with work, and to help work faster, I created a 20-question checklist, just 20 questions that every new addiction patient was asked, and one of my assistants saw them first and went through the checklist with them, and then I saw them, and in 5 minutes with the checklist report, I could find out what it took me 25 or 35 minutes without the checklist. But checklists still required quite a lot of work, and could only be done in the clinic and were inconvenient. And then there were more and more apps, and we realized that an app was what we really needed. And the app needed to be on the phone so people could do the app anytime, anywhere on their phone. But apps are a lot of work and they cost a lot of money. But 18 months ago we started the Mental Fix It app. And the Mental Fix It app we finished about a year ago, and it was quite helpful, or very helpful, for the people who did it. But there were 38 questions and it took about 10 minutes to do, and a lot of people just not willing to spend 10 minutes. Everything now, for most people, not for everyone, for most people, is go, go, go. It's got to be fast. So after a few months we reduced the 38 questions to 19 questions, and they could do that in 5 minutes. They didn't have to make up answers or write answers to the questions. Each question had 3 possible answers. They just had to read the question and tap which one of those 3 answers was closest to being right for them. But now we're revising the Mental Fix It app to make it a 2-minute app, and my goal is for a person who's in trouble with mental health problems to be able to whiz their phone out, find the App Store or Google Play icon and tap on it and download the Mental Fix It app in a few seconds, and then in 2 minutes to be able to answer the questions which are asked differently and in a much more helpful way, and in a minute to read the report and think about the report. And the report gives them 4 things. One of them is which 6 of our videos would help their particular problems most, because different people have different problems, and which of the 100 videos should they watch? It's going to take them a long time to watch them all, so which one should they watch? Well, the app tells them in 2 or 3 minutes from the time you start the app. It will tell you which 6 videos are going to help your particular problems most. It also tells them which medicines are likely to help them most, and they can research that and think about it and discuss it with their doctor and get a prescription. And thirdly, it gives them a complete list of everything that they've tapped as a problem. And that's so important. You need to know all your problems. If you're going to get completely better, you need to know everything that's got to be fixed. And one of the problems with talk therapy is it's so slow that you usually only get to the biggest problem, or the biggest 2 problems, and there are several other smaller problems which are smaller, but they're still a problem, which you don't get to. But with the Mental Fix It app, you get a list of everything, and everything's got a score. The highest scoring, biggest problems come first, and the lowest scoring problems come last. So a high scoring problem like severe post-traumatic stress disorder, or severe bipolar disorder, or severe attention deficit disorder gets a score of 12 or 14 or 15. And a mild problem like a mild to moderate sleep difficulties or mild to moderate anxiety gets a low score of maybe 3, 4 or 5. But you get a list and it's got all your problems that you think are a problem to you, and that's what matters. Doesn't matter what other people think. What's a problem for you? There they all are, and they all got a score. And the 4th thing is you get a total score each time you do the check, and you should do it often, because every time you do it you get clearer and clearer and clearer about what your problems are, what caused them, how to fix them. So keep repeating, and each time the app adds all those problem scores together, the high scoring ones, the medium scoring ones, the low scoring ones, give you a total score, and then it puts that total score in a graph. So when you've done the app check 10 times, there are 10 scores in a graph. And that's very, very important, because if you're having the right treatment, your scores get better and better and better. And if your score's not getting better, then you're not getting the right treatment. And you sort of know whether something is working or not, and whether you're getting better or not, but this is much more precise, more detailed, and so you know quite quickly whether a treatment helps you. And you also know quite quickly whether things that you do or don't do, or things in your life that happen, are helpful or unhelpful. Sorry, I'm going to sneeze again in a minute, but yeah, so you go to a lecture, you read a book, you have counselling, whatever, and you can see the next time you do the app, you can see from your total score and the graph of scores whether that helped you or not. And if you go somewhere or do something, and then the next time you do the app check, your score is worse, you know that's something you better try to avoid in the future. So to get rapid feedback about what helps you and makes you better and what makes you worse is really important in getting better. You know where you are, it helps to motivate you, it helps you to discipline yourself. If you like doing something and you're not sure whether it hurts you or not, and you see that it damages your score gets worse, you know that you shouldn't do that, and it's easier not to do that thing. So where are we up to now? That's videos, websites, the checklist and the app, and then live streaming. This is live streaming what we're doing now, and that's sort of a form of videos, but a lot of people like to watch live streaming and they learn well from it. So I now do it 4 times a week. I'm not sure how long I can keep going. Been doing it for about 6 months and it's fairly wearing, but I was doing it on Wednesday, Friday, Saturday and Sunday evenings at 7 p.m. Perth time, which is 9 p.m. Sydney and Melbourne time, but we found that that's 7 a.m. New York time and 4 a.m. Los Angeles time, and God knows what, but something like that in London. And sometimes 20 or 30% of our viewers were in America, and 10% were in the UK. So did they stay up very late to watch the live streaming, or did they get up very early? So now I do the Sunday session at 9 a.m. Perth time, which is 11 a.m. Sydney and Melbourne time, and sometime on Saturday evening in the Northern Hemisphere. Yeah, so live streaming, the 4th tool. The 5th tool is powder medicine. Non-addictive, powder, tasty medicine in pocket dispensers. I designed and got made pocket dispensers, so you can carry your medicine around in your pocket like that. And whenever you start to have a problem, either a mental health distress or an addiction craving, you whiz it out and drop the powder on your tongue, and it starts working in 5 minutes. So why does powder on your tongue start working in 5 minutes when what you swallow takes half an hour to an hour to start taking? Well, it's because the blood vessels in your tongue are so near the surface. That's what makes your tongue pink or red. the blood vessels are so close to the surface. And if you sprinkle thousands of tiny grains of medicine on your tongue and suck it, don't swallow it, suck it, it gets into your bloodstream in 5 minutes and goes straight to your brain and starts to work. And if you've got it in a powder dispenser, originally we had it in bottles with little scoops, but that was inconvenient. But if you got it in your pocket in a dispenser, you can take it like that. As soon as a problem starts, that problem won't get nearly as bad. I'm not saying it'll stop it completely, but it'll make it much better. It makes that particular episode much better. The mental distress doesn't get as strong, the craving doesn't get as strong. But it's not just that. Everything that happens in us and that we do happens through electrical messages and chemical messages. Electrical messages are messages from our brain that flow along our nerves. If I move my finger like that, that's because the message has gone from my brain down the nerve to my finger to the muscles that move my finger. Or chemical messages. If I do something, I get angry, I shout, or I get embarrassed and go red in the face, or whatever, that's because of chemical messages. And chemicals are produced by the brain and by the glands that flow in the blood vessels to every part of our body and make things happen. So everything that happens as a result of an electrical trigger and message flow, or a chemical trigger and or chemical message flow. And when we stop things, we weaken the flows, because the flows become habits. The more often they flow, the stronger they get, and the more easily they get triggered. But if we slow them down, that weakens them. And when you slow them down and weaken them, then it's easier to slow them down even more the next time. And then the next time it's even easier to slow them down. So the way you stop things that you don't want is to delay them and slow them down. If possible, not do them, but that's often too difficult. A lot of the old timers in my age group favour going cold turkey. That's what they would tell you in AA, go cold turkey. But that's very difficult, and most people would relapse after 1 or 2 or 3 days. But it's much better to weaken the triggers and the messages, electrical or chemical, by delaying them. So you can delay them with willpower, and you should try to do that. If you're very sure that something is not good for you, that your life would be better without it, well, think about it, talk about it, get very sure about it, and then use willpower. But also you can do what I call quick switching. If you got something that you want to do and you don't want to do it because it's harmful for you or someone close to you, or bad for your life, get a few things that you can do instead. And whenever you start to think of doing the thing you don't want to do, quick switch to doing that other thing. Quick switching to ringing someone and talking to them. Quick switch to playing something on your instrument. Quick switching to reading, quick switching to eating, quick switching to something that's harmless. So that's another way of delaying things. And of course, medicines are a way of delaying things. And medicines are a bit controversial. And that's because so many of them are addictive. So I sympathise with the people who say medicines are bad. Well, a lot of medicines are bad, but some medicines are wonderful. But they have to be non-addictive. You have to get the right amount for you, which is quite different to everyone else. Depends on your weight, how well you absorb it, how quickly you burn it, how quickly you excrete it. You have to get the right amount, you have to get the right times, and you have to get the right medicines, of course. So powder medicines have a lot of advantages, but tablets and capsules suit the manufacturers, so that's what they make. But powder medicines, first of all, as we mentioned, start to work in 5 minutes. They get in, if you suck them and absorb them through your tongue, they don't have to go right down your gut and pass through your liver. They start to work in 5 minutes. And if they taste very nice, if they've got flavouring in them, you soon develop what's called taste conditioning. That is, your body associates, oh, you have a lovely taste, and then 5 minutes later you start to get better. And when that association is strong enough, it develops what's called conditioning. You've probably heard of Pavlov's dog conditioning. Pavlov was a Russian psychologist 100 years ago, and when he took meat to his dogs, they would salivate, they would slobber. And after a while, when they got used to him coming and giving them meat, when they heard his footsteps in the hall 3 minutes away, they would start to salivate. Well, it's a bit like that with nice tasting medicine. As soon as you taste it, it starts to work, even before it's absorbed. Taste conditioning. So if the medicine starts to work in seconds, as soon as the powder gets to your taste buds at the back of your tongue, that's even better. The earlier you suppress something, the more you can suppress it, the easier it is to suppress it. Much harder to make things go away than to slow them down or stop them coming. So that's the second advantage of powders. The third advantage of powders is you can get the right amount for you. With tablets, people and doctors sort of think, oh yeah, you take one or you take two. Or maybe if you're fussy, you take half one or you take 1.5. But that's not very accurate. The biggest factor in the biggest factors in how much you need are how much you weigh. If you're 45 kilos, you need a totally different dose to if you're 95 kilos or you're 145 kilos. So your weight is a major factor in how big your dose needs to be. Then your speed of absorption is important, or your absorption is important. Some people's guts are more faster and more efficient in absorbing medicines than others. And then it depends on the speed of your metabolism. Some people have faster chemistry and everything gets burned quicker, including the medicines. And then it depends how fast you excrete the medicine, because when the medicine gets into your bloodstream, which it has to get to the part where it works, it also flows through your liver and through your kidneys, and your kidneys start to excrete it, and your liver starts to excrete it. So if you've got a very healthy liver, you need a different dose to if your liver half buggered by too much alcohol, it doesn't work very well. You need a much lower dose than the usual dose that people of your size would take. Might be too much for you. And if you don't get enough of a medicine, it doesn't work very well. And if you get too much of it, you get side effects. So with powder, what we do is the first dispenser, we give them low strength, and they take 3, 4 or 5 or 6 doses, and they work out how many doses gives them the best results, and the lowest side effect. It's not just a matter of taking tablets or capsules. You have to find out what's right for you. And when we find that this person needs 3 small doses, we can give them a dispenser that's got stronger medicine that gives them that same amount in 1 dose. Or they need 5 small doses, we give them a stronger medicine that gives them the right amount. So when I was a boy a long time ago, you walked into a pharmacy, you saw all these bottles with different coloured liquids, and they were all the medicines, because back then the medicines were mostly mixtures, and you'd take a teaspoon or half a teaspoon or 2 teaspoons or a tablespoon, and the spoons were all different sizes. They didn't make plastic spoons just for medicine which were accurate. So God knows how many people got what they needed. But because liquid medicines tend to deteriorate, tend to break down, lose their effect faster, they switch to dry medicines, tablets or capsules. But tablets or capsules have these problems of being slow to be absorbed and difficult to get the right amount. But with the flexibility of powder, you can get the right amount for you, which might vary from day to day. For instance, if you're taking our anger fix medicine because you've got an anger problem, and sadly there's a lot of anger in Australia, and one woman is killed every 4 days in Australia by her partner or ex-partner because he's got an anger problem. Well, some days you're more angry than others, so you need a bigger dose some days than other days, and it's easier to get to fine-tune your dose according to the severity of the particular episode. And then there's another wonderful thing about powder medicines is that you can mix 2, 3 or 4 powder medicines together, and you can stop 2 or 3 mental health distresses and an addiction craving with 1 powder, which is actually a mixture of 2, 3 or 4 powders. Well, of course you can do that with tablets as well. And when I starting in 1997 started to treat heroin addiction, one year I treated 700 new patients with heroin addiction. I already had quite a lot of old patients with heroin addiction, a lot of heroin addiction and a lot of different mental health disorders. And I discovered that almost 19 out of 20 of them had mental disorders, and very few of them only had 1 mental disorder. If they had severe anxiety, they also had difficulty sleeping, they often had depression, and some of them had anger problems. If they had bipolar disorder, well, if they had ADD, ADHD, about a quarter of them seemed to, if they had got that in childhood, in their late teens or 20s, they developed bipolar disorder. So they had multiple conditions, and one tablet didn't fix them. And then if they had multiple mental health conditions and an addiction as well, well, they had multiple problems. They needed multiple medicines, and so a lot of people got better best on 3 different prescriptions for 3 different medicines. say an anxiety and sleep medicine and a depression medicine, or an ADD medicine and an anxiety and a depression medicine. But that caused some serious problems. Not very often, but very bad problems for me. The 65-year-old man taking 17 Stilnox tablets a day, which I mentioned a little while ago, he had multiple problems. And one of his problems was he used to keep on threatening his family, who he didn't live with. If they didn't do what he wanted, he'd OD. He'd take too many of his tablets, and they knew he took too many anyway, and that worried them. But anyway, his doctor sent him to me, and I found he had about, I can't remember exactly now, but three mental health problems plus an addiction to Stilnox. And I found the right 3 medicines for him, and he stopped the Stilnox, and he was a lot better. And he was better for 3 years, 3.5 years, and then he disappeared. And when his family went looking for him, they found him unconscious on the kitchen floor. He'd OD'd, which he'd done many times before, but this time he'd been on the floor for maybe 2 or 3 days, and he had very bad pressure sores and compartmental syndrome, where muscles had died because they'd just got no circulation for such a long time. So he got carted off to the casualty department at the big hospital, and in the big hospital the young doctors decided that this man had had too much medicine, and they reported me to the medical board, and the medical board said I'd given him too much medicine and fined me $10,000. Well, nobody recognized the fact that he had multiple severe mental health disorders that all needed to be treated. And it was much safer and much easier to give people multiple medicines in a powder. Because if you've got the powder in a pocket dispenser like that, and if you decide you want to OD, it takes you so long. You can't just take the top off the bottle and swallow all the tablets, or tear the packaging apart and swallow all the tablets at once. You have to pop out one dose at a time, and it might take you 20 or 30 minutes to pop out enough doses out of a pocket dispenser to cause you to OD. And in the meantime, the medicine's working, and you calm down and you stop and you don't OD. Yeah, so that's another tool. So 101-minute videos, SmileFixit.com and mentalhealthvideos.com, the Mental Fixit app, live streaming, powder medicines, non-addictive powder tasty combination medicines, pocket dispensers. The 6th tool. The 7th tool is a heartbeat meditation aid. Meditation is so valuable for people with mental health problems and addictions. So helpful in helping them to calm down, to relax, to be calm, and not to fill themselves up with alcohol, and not to fill themselves up with heroin or whatever. But the people who most need to meditate and would benefit most from meditating often can't do it, can't learn it, because meditation is a habit. In meditation, you develop the habit of focusing on something and forgetting everything else. You take a holiday, a rest from your problems by focusing on something which takes your attention away from all your problems that are driving you mad and causing you to abuse substances. And what the people who teach meditation usually do is teach you to focus on a word. You focus on this word and you just keep on saying it again and again and again and again, and while you're saying this word and focusing on it, you can unfocus. While you're focusing on this word, you can unfocus from your worries and relax. And your mind keeps wandering back to your worries, and you keep refocusing and wandering and refocusing. Or they teach you to focus on your breathing. Breathe in, breathe out, breathe in, breathe out. Stop thinking about your worries and stresses and dramas, and just focus on your breathing. But focusing on your breathing or on a word are not very attention grabbing. And so a lot of the people who most need to meditate, would most benefit from meditation, can't learn to do it. If you can do it, you gradually get better and better and better at it. And someone who's been meditating for 10, 20 or 30 years can just do it like that. Driving the car, come to the red light, stop, meditate for a minute, and then keep going. And that's so valuable, anytime, anywhere. Of course, they probably have a quiet time in a quiet place where they do their main meditation, but they can meditate anytime when they've got a few moments or a few minutes, and it would help them. But it might take you 3 months to learn to do that. It might take you 6 months. So I'd been listening to people's hearts with a stethoscope for a long time, 40 or 50 years, and I decided heartbeats are loud and interesting and attention grabbing, so I got a cheap stethoscope, cut it short, and taught people to meditate doing that. That's the listening part. You just put the listening part down under the clothes, right on the chest, and listen to your heart, and it's loud and it's strong and it's interesting and much easier to focus on than breathing or repeating a word. And when you've done that for a couple of months, then you can do the meditation just focusing on your breathing, which is the best thing to do. So I've got a few more tools coming. I'll just tell you briefly about one. This is a bigger pocket dispenser, a pocket powder dispenser, and it's for dispensing fruit powders. In my 53 years as a doctor, there were two things that got worse and worse and worse. One was mental health and addiction, and the other was obesity, diabetes, blocked arteries, clogged arteries. So we've just been talking about the mental health, but the obesity is a big problem. It's a big problem because when you have too many calories, which is what causes obesity, your blood sugar gets too high, and when your blood sugar gets too high, you start to get diabetes. And also, a lot of the too many calories get turned into fat, so you get obese. And the mixture of fat and sugar tends to clog up the arteries, so the blood doesn't flow properly, so you have a heart attack, or you have a stroke, or your toes get cold and then turn black, and or your eyes, there's not enough blood flow in your eyes and your vision deteriorates, or there's not enough blood in your brain and you get dementia. So a pretty big problem. And how did that come about? It came about because people's lifestyle changed and they do less and less and less physical activity, so they need less and less calories to give them the energy to do the physical activity. One of my grandfathers was a blacksmith and the other one was a farmer, and they both worked long hours doing hard physical work, and they needed 3,000 to 4,000 calories of food a day. My blacksmith grandfather started work at 6:30 every morning, 6 days a week, and worked all day doing heavy physical work. And I remember that my farming family had to have so much food at morning and afternoon tea time, they needed a knife and fork. They had 5 meals a day, not 3. Well, I earned my living sitting down mostly. I need about 1,500 calories, and I got very overweight. And I knew that was dangerous, and it was unpleasant. And so many girls these days are so overweight, and it spoils their chances of marrying a good guy. So it's a serious social problem. It's an epidemic in the richer countries because they need less and less calories, and they get more and more calories. They get more and more calories because food is so plentiful, but also because of the nature of the food. Sugar became a gold mine for food manufacturers and drink manufacturers. 300 years ago, sugar was rare. It was much sought after because people loved its sweet taste. And then 300 years ago, they started to mass produce it, and they got more and more efficient at mass producing it, and it turned into a gold mine for drink and food manufacturers because people loved the taste, and it was cheap, and it was addictive. Sugar is as addictive as cocaine. If you don't believe that, we'll do Google search on it. So the manufacturers loved putting sugar in. It didn't cost them very much. It sold a lot more, but people got fat and ugly and diabetes. So I thought, let's give them something that's low calorie, not high calorie, low calorie, and something that humans are used to having. And what for 97% of human history, life, the main thing has been fibrous food stuff. Before 12,000 years ago, there was no farms, and there were no factories. People just got up in the morning and they went out into nature and they found food. They found food, leaves, stems, fruits, nuts, seeds, uh, uh, vegetable things, and they ate them. So, and they were very low calorie, so they had to eat 3 or 4 or 5 kilos a day to meet their needs. So the obvious thing to do was to supply people with something that they loved the taste, because something that all humans have always done from the day they're born to the day they die is have put food in their mouth, preferably that has a lovely taste. And so food powders were becoming more and more commonly used for drinks and for sweets and foods. So they're becoming available. But it involved cooking and mucking around. So I thought, well, let's make it quick and easy. We got used to making pocket powder dispensers, so we made food pocket powder dispensers. They had to be different to the medicine dispensers, because the medicine dispensers were only 1/5 of a mil, which is a small amount, not enough to give a good taste. But these powder medicine powder fruit dispensers hold 1 1/4 mils, which is enough to get a good taste. So you just have them in your pocket, and whenever you feel like a nice taste, whiz it out and have it. If you think of having some sugar or some chocolate or some cake or whiz that out and have a lovely taste of low calorie, high fiber fruit powder instead. So I hope that in March, sometime in March, we'll have about 5,000 of these to get started. Well, I think that's enough for today, so I'll say goodbye, and please send me your questions, the things you're interested in, and any criticisms or information that you think would help to make the live streaming or the other work better. Please send them in the platform that you watch the live streaming on, or send them in our internet, which is smilefixit.com. Smilefixit.com is our email. You can find that at smilefixit.com. Sorry, and the email is healthestuff@gmail.com. healthestuff@gmail.com is the email address. And if you don't remember that, just look at smilefixit.com, and you'll find that email.